All right. Okay, I got us on there. Everyone's streaming in. Welcome everybody to our webinar for the evening. We've got a new presenter with us this time around. Alex, welcome.
Thank you, Mike.
And you're new to this, so we're very
new.
fortunate to have you though, Alex, because you are very knowledgeable and experienced. So we're really glad that you're a part of this one this time around.
It's my pleasure.
So that's great.
There's nothing else to do out there, so yeah.
Pardon me?
Well, there's not much to do out there, so
yeah, yeah, no doubt. All right. Well, I'm just seeing everyone stream in here, and this is great. Everyone's going to start logging on. Christmas cookies. Alex, are you into Christmas cookies or what?
I am, and all cookies actually. That's the truth.
Oh, yeah.
Not just Christmas cookies.
Okay. Are you doing it? Are you making any Christmas cookies this year?
I am not. I am not the baker in the house, so.
Okay.
It's up to my wife, but I can't ask her to do too much because she's already with the baby 24/7.
Yeah.
So if I ask her to make her cookies, I don't know if that'll go well.
So let's hear what people have to say. What's your favorite holiday cookie or Christmas cookie? Feel free to use the chat, folks. We've done it before. You'll see there that you can start inputting information. Gingerbread from Cindy, nice. I'm like the old favorite shortbread for me. Giacomo, welcome. Gingerbread for Giacomo. Excellent. Do you make any gingerbread men out of this gingerbread, folks, or is this just like simple cookies? Anyone? Any special designs? My kids made some shortbread on the weekend, so they had their tweezers out, placing little sparkles and sprinkles all over these things. So it was pretty impressive. But yeah, no, certainly. This is the cookie season, and everyone's going to start. Yeah, tweezers. I know, Jack. When everyone's going to start just pounding back cookies here, and there might be a couple extra pounds by the end of the the holiday season. This year will be a different holiday than any other. That's for sure. So hopefully, we're not all just eating cookies all for the whole season. What about? What's your favorite, Alex? I'll throw this out to you, and then anyone in the chat can throw this out. For a holiday meal over the holidays, are you a turkey kind of guy? Are you a ham kind of guy? What's your preference?
Oh, that's a good question. I'll have to go with ham with this one.
Oh yeah?
Because I've yet to have a really good turkey. Yeah. So maybe you could invite me over post-COVID,
yeah.
Mike?
Post-COVID, I'll cook you a turkey, no problem.
Do you ever smoke it, Mike? You ever smoke a turkey?
I have smoked a turkey, yes.
I hear it's tough.
It's not too bad. But it's good.
Yeah.
Fresh turkey with cranberry sauce. Yeah, that's great. Anyone else? Turkey or ham or something else? Maybe Giacomo might pipe in here with like a different dish, because I know he's into his food. So, oh, nice. Lobster, amazing. That sounds great. This is might as well. Christmas Eve fish fry, Giacomo. That's right. Yeah, that's a big one. All right. So we got a couple minutes here, guys, before we get started. As always, we welcome questions along the way. Aaron Albom, one of our physios at the clinic, is also on board tonight with us. Hi, Aaron.
Hello, everyone.
Hey. So Aaron will be helping out run things in the background, so she'll keep an eye on the chat. If you have questions, I'm sure you will. Please enter them into the chat. You can either click to all panelists and attendees or just to panelists. So Aaron, Alex, and myself will see these questions. Or if you think it's a question that everyone might, want to know the answer to, then certainly put it to everyone. And she'll keep track of all that, and we'll be able to kind of collect and gather all these questions by the end. Okay. So we'll just give it another minute here. We're still waiting for everyone to come on in. Right. Okay. I think maybe we'll get started because this will be a fairly busy topic to talk about, Alex.
For sure.
And I also think, you know, there's going to be lots of questions. So I think it's probably best we get started. So with that, let's get going here. So everyone, welcome again. Glad you guys can join us. There's not too much exciting stuff on TV these days, and everyone's looking for something a little different. So hopefully we can enlighten you with a bit of information and knowledge and a little education about probably one of the most common injuries we tend to see at the clinic, the low back pain. Okay, so welcome. Tonight we're going to kind of give you what we like to call a little bit of a survival guide. We can't give you everything. There's just so much information about the low back. So what we're planning to do in the next, 30 to 45 minutes is outline some key concepts, show you some, specifics that might help you along the way. Okay. So let's get started here. For those who are new to a webinar, you'll notice on the bottom tab of your webinar, there'll be a little chat button. You can simply chat in, put in a message here in the chat to us, ask us a question. We are going to ask you guys a few questions along the way, and I wouldn't mind having some interaction from everybody. So it'd be good to get people involved. So please feel free to indicate information in the chat there. A little bit about us. So again, my name's Mike Pomelli. I'm one of the owners at the clinic here in Aurora, and also an owner in Nobleton at Nobleton Physiotherapy. I've been a physiotherapist since 2003, and along the way, I've worked overseas in New Zealand. I've advanced a lot of my skills individually in a manual therapy framework. I've dealt with a lot of patients with low back pain over my 17, almost 18 years of experience. And, I've got a bit of info tonight that I can certainly help you, but I'm glad to have Alex and Aaron here on this topic with us tonight. Alex is one of our senior therapists in Aurora, and he brings a plethora of knowledge as well. So Alex, go ahead and you can tell everybody a little bit about yourself.
Oh, thanks, Mike. So I've been here at Aurora Sports Medicine Professionals for almost 6 years now. And I've certainly learned a lot from Mike. So maybe to Mike, this is all just, something he's like, this is all stuff from Mike. So this will probably be boring to him, what I have to say. But otherwise, like as Mike said, that low back pain is something that we do often see here in clinic. It's funny because you sometimes get asked, I sometimes get asked that do physiotherapists treat low back pain? Because sometimes when someone thinks about low back pain, the first practitioner that comes up to their mind is a chiropractor. So I'd be happy to share my knowledge, and so will Mike. And as Mike has mentioned, this will be a survival guide. We'll do our very best to cover as much as we can. But if you guys have any questions at all at the end of the presentation, Mike and I will be more than happy to help address those questions.
Awesome. Okay, so just a little bit, the information we're giving here is it's general information. We don't know enough about the specifics of everyone who's with us tonight, and maybe your own back pain that you're currently having. So we certainly would hope you take some of this information, let it soak in, decide. Maybe there's a few things that we show you that you can try, but it's not really meant to be a complete substitute for proper medical advice, diagnosis, or treatment. Certainly, if you need something more past tonight, we'll go over that, and we can certainly help you out with that. Okay. Okay, so moving on here, tonight's agenda. First thing I was going to speak about here is working from home, why it's ruining our backs. And this is very, very common these days. We're getting a lot of patients coming in with these problems. We're going to talk about some of the most common myths about back pain. Alex is going to discuss those and maybe dispel some of the myths. I'm going to be talking about the two most common types of low back pain. Alex will get into some strategies, some advice, different techniques to treat your own back pain, looking at it from a variety of different angles, not just exercise. He's also going to bring up the number one mistake that stops our healing process when we're healing with these low back injuries. And we'll do our Q&A, our live Q&A, and we also have some prizes tonight to give away. So we want everyone to, hang out till the end. We have three excellent prizes we're gonna basically hand out tonight. Okay. So first off, I'll get it going here. Working from home. I bet there's a lot of people on this webinar tonight who are working from home. Nearly, a large percentage of the population now with COVID is working from home. And these are some of the biggest issues that I've seen in my practice recently that just keeps making me I wanted to keep doing this webinar because I felt this is a pressing issue right now. Number one, it's an inadequate workspace setup. This is the primary issue that's going on right now. Whether it's sitting at your kitchen table, the breakfast bar, on a bar stool, or just a kitchen chair, they're just not really right for sitting for hours on end doing your work. Okay. Second thing here, I've noticed a big change in people's activity levels. They're just less active. Okay. When we would go to our workplace, you get in your car, you drive, maybe you have to commute downtown, you get on the subway or you get on the GO train, but you walk to the GO train, you walk to your office building, you get into your office building, you go for lunch, you take a break, you go get a coffee. So there's lots of points in our day where we'll get up and walk and move around. I'm finding most people are saying they're sitting hours on end, 3, 4, 5, 6 hours without even moving because they're just stuck to their work and they're at home, not building any time to exercise. To that point, there's these longer periods of constant work. Okay, so it's those 4, 5, 6 hours. Our tissues in our body can't handle that. We need to move. We need to movement allows blood to kind of regenerate and move around the body, and it reduces the strain and stress on the tissues. Improper chair and ergonomic sitting. This is a big one. I mean, you can see in this picture right here, he's probably using the worst chair possible. Over time, it feels good the first month, it's fine, but now we're into month 7, 8, 9, and now we're starting to feel all these aches and pains. Okay, so a poor chair, poor ergonomic sitting postures, these are all factors. Now, of course, we can't change all this. Everyone is still going to be working from home, still needs to work at their kitchen table, still has to sit at that kitchen chair. But at least tonight, we're going to give you a few options and some little tricks that you can try to maybe make that a little less difficult. And finally, listen, there's stress. We all have stress right now. There's a ton of stress out there, family life. You're trying to work. Some people have their kids around with them if they're not of school age. There's COVID concerns, whether it's a family member, watching the news every day. It is stressing everybody out. Finances. These are all factors that play into our pain responses in general. Okay. So we want to learn a little bit about your back pain, and I want to just put out a little poll here because I just want to know, what everyone is experiencing right now. So I've got a series of some questions here that I'd like everyone to get answering. Alex, is that popping up now?
Yep.
Okay, good. So this is a little intro poll, everybody. Again, I just kind of want to see, what is everyone sort of feeling right now, just so we can get a sense of who's out here. So currently having back pain. I'm going to share these results once we stop it, but I'll give everyone a few minutes to fill this out. It's always good to understand, Alex, what people are experiencing. And they'll see as our presentation is going how age is related, medications, how do they treat their back. So I'll share some of these results as we go here, but I'm just going to let a portion of these all stream in here. This is looking good. There's lots of information out there. So we're really glad to provide as much detail as we can tonight here. A large percentage here of people that are having back pain. So that is interesting. I'm hoping we can help some people tonight. Okay, I'm going to end that there. We're almost at 100%. Okay. Oh, they're still strolling in. Everyone's getting it done. This is good. We have an engaged audience tonight, Alex. This is good. All right. Let's end that there. And I'm going to share the results here. So let me know when you see those, Alex.
Yep. See.
Okay. So currently having back pain. Look, we got 71% of people having back pain. How old are you? So the majority are in that sort of 36 to 55, but the 55 plus is our main population tonight. People taking medication? No. And yes, some people are. How do you normally treat your back? So this is varied all over. Medications, some exercise. People are doing their own home exercises. Some physio, massage, chiropractic, nothing. So 7 people tonight. We're going to hopefully give you some info. You can try to treat your own back tonight. Where do you get your information about your back pain? Friends and family, doctor, rehab pros. So that's great. I'm glad there are some, people are using resources to help them. That's good. Some of the internet. So Dr. Google, as everyone knows, offers a bit of help. Nowhere, I need some help. Well, we're here to help you tonight. So there's seven of you folks there. Okay. So let's move on here. I just want to ask a quick question. If anyone wants to type into the chat, what's the most frustrating thing about your back pain right now? If you can, share your experience, write it in the chat. It's good to see what people are feeling. I welcome, write it in that chat, share your experience. What's the most frustrating thing about your back pain right now? Okay. It disrupts your sleep. Okay, thanks for that. It's persistent, so it keeps going. Yeah, like that's chronic pain. Unfortunately, there's something to fix there. Any treatment does not last, keeps coming back, okay? Lots of stuff. Feels good one day, bad the next. It's random. Okay, so these are all, what we're gonna try to do here is explain how the back works and obviously look for a consistent pattern here. You never know when it's gonna happen. True, most back pain isn't just because of one thing you just did. It's probably a series of events over months of time pre-existing to that injury that usually causes a problem. You're not sure what triggers it. Good. We're going to discuss what all these triggers could be tonight. And perhaps there's things that, you're doing in your daily life that you're going to change based on what we tell you tonight. Hurts in the morning when you're trying to get up. Exactly. Okay. Perfect. Thank you, everyone. That's great. I appreciate everyone putting that in because there's a lot of great information there. And I hope everyone realizes you're not in this alone. There's a lot of people suffering the same back pain. So first things first here, 5 myths Alex is going to go through about low back pain. Okay, so Alex, I'll move the slides along here for you. You're going to dispel some myths, okay?
Sounds good. All right, Meg. All right, so like I said, we'll go over the 5 most common myths you would be hearing about low back pain. The first one you often hear, and you may have been told this many, many times before, especially from your mom, is to always sit up as straight as you can. Now, certainly slouching is bad, but also sitting up too straight, because I understand you're trying to consciously keep that posture straight. But if you do sit too straight and still for long periods of time, it could also be a strain on your back as well. Now, this is especially true if you don't lean and rest onto the chair's backrest, where the backrest really allows your lower back to finally relax and maintain an appropriate curve when sitting for long periods of time. Because oftentimes when we're standing up and we're doing things, that's when our lower back muscles are engaged to keep that posture. But there are moments that you do need to sit down and finally rest all of your muscles. And instead of slouching and utilizing your low back muscles to continue to support your low back, why not take advantage of the backrest part of the chair to finally give those muscles of your lower back a break finally. On to the next slide. The second myth is lifting heavy things is bad for your back. So it's not necessarily how much you lift, but it's how you do it. Ideally, you always want to get directly in front of the object, squat down to it using your legs, engage your core to keep your back straight, and always be using your leg muscles to push up the load within your center of gravity. It's all about proper body mechanics, which is the key to keeping your back safe. The next myth that you might have heard is bed rest is the best method of treating your low back pain. So resting can help an acute strain or low back injury, but however, what research shows is that a day or two in bed can actually make it a lot worse, because ideally, continuing to move your body gently, even from the moment you have that acute strain, it's actually very, very important to help address the inflammation of your joints and the muscles of your lower back. The fourth myth here is being overweight is unrelated to low back pain. So as you might guess, extra pounds will put stress and pressure on the joints and muscles of your lower back. But low back pain is also most common among people who are just out of shape in general, especially those weekend warriors who really push themselves hard after sitting around all week. So we do typically just sit around from Monday to Friday, and on the weekends we like to take up a sport like golfing, hockey, and so forth. But if 5 days of the week your muscles are deconditioning itself, and suddenly you put on a hard physical demand on the muscles, and that's where these strains typically tend to appear as well. And people always say that they need a day or two to recover after their sports. But ideally, if you just keep your back conditioned on a daily basis, and when I say condition, keeping those muscles moving with a smaller exercise on a daily basis, that's how you can meet all those physical demands that you wish to do with sport playing or any and such. The last myth here is exercise is bad for your low back pain. So regular exercise, as I mentioned, will help prevent back pain. And doctors actually will recommend exercising early once injured. They'll usually start with gentle movements, really gentle movements when you suddenly come into an acute strain, and gradually build up the intensity from there. When the immediate pain goes away, an exercise plan, a routine exercise plan focusing on the flexibility, the core, and overall body strength can help prevent low back pain injuries from occurring. So those are the 5 myths, and we'll definitely build up from these 5 myths with some more information later on as well.
Great, thanks, Alex. Okay, so I'm just going to do a quick little anatomy lesson for everybody, just so you can kind of understand what what the back looks like. It's one thing to say I have a sore back, but it's really important to understand if you can see it and look at it, understand it. We always find that's part of the best treatment method is educating people. So just taking a look here at the back, simply, it's a simple structure with a vertebral body. So there's the body of the spine, and here it is as well. Okay, these two areas. You're going to have facet joints, which are the little spiky kind of prominences at the back here, and they'll connect with the other joint that goes above them. So at each level or each segment, you're going to have your 2 facet joints and your vertebral body. And then finally, the third simple piece is the disc, the little shock absorber that actually rests in between the 2 vertebral body. Okay, all these components, they work together. Injury in one area will lead to a cascade of issues in the other areas. It's never just one specific thing. Okay, you can see on this picture here the relationship of our nerves. Okay, so there's the vertebral body, our facet joints, and the discs, and then you'll see this little opening is where the nerves will come out. So this little opening in through here, the nerve will exit out there, and that's where we'll have different neural type pains as well. Okay, so how does the back work? Simply put, our vertebral body accepts 70% of our load, okay? And the other 30% is absorbed by the back half of the sort of vertebral complex there. So those joints that I was just mentioning. So 70% is absorbed through the body and the disc, the other 30% through those joints. With various movements, so you can see here, if I bend forward, I'm going to have higher load on the vertebral body as opposed to the back part. If I lean backwards, I'm going to have greater load on those little joints in the back and less on the disc or vertebral body. So our ability to accept load on the spine, it has many variables, and often that's why we have our pain. So it's these variables that we need to control and correct. And if we can make little changes, that's when you can get your improvements overall. I was just mentioning it to a patient this week, actually. Consider it like your back pain is in the center of a wheel, and there's spokes of the wheel all coming off, and these spokes are all reasons why you have back pain. If you can start to work on these little spokes, you can take away all these problems that are contributing to that central back pain issue. Okay, so there are many different reasons that your back pain is occurring, and it's our job to help you through those. But tonight you're going to learn a bit about them. Okay, so more recently, there's been a bit of a shift with how we describe low back pain. So I'm going to talk about the two most common types. Recently in 2019, the American Academy of Manipulative Physical Therapists have come out with this paradigm shift. We used to hear this term, degenerative disc disease, okay? DDD. Every doctor tells you, oh yeah, you've got some DDD, degenerative disc disease, and everyone freaks out because they hear the word disease and they think there's a problem. What they've sort of adapted now is they're now moving towards normal age-related changes, okay? Which means every one of us will experience these changes in our back, in our life, and it's not a disease. So I want people to understand that. The more they learn about it, the calmer they'll feel about it. Typically, these changes occur from the age of 35, moving on over the age of, past the age of 80, okay? And they'll usually peak at that 70 to 75 year time frame. Okay, I'm going to describe this picture here on the next slide a little bit more, but this can sort of show you some of the changes that are occurring. The second most common type of low back pain is our disc bulge or herniations. Okay, these will affect the people mostly in the 30 to 50 age category, peaking at 35. So tonight, based on some of our previous stats in the poll, most people here tonight are from 35 to 55 plus. So this is great information to gather tonight. So the first one here, the normal age-related changes. With increased age, basically you get degeneration occurring to the disc, this part in here, and the joints, these guys here, those facet joints, okay? Most typically, the primary reason that we have these changes going on is actually bony changes. So there's bone loss occurring. As you know, everyone, as each decade goes by, we will lose bone, unfortunately. Those are words like osteoporosis, osteopenia. There is a natural progression of bone loss, hence why we continuously tell people to exercise and stay active to help energize those bones to stay strong and keep rebuilding. When we do nothing and we're sedentary, we often lose a lot of calcium in our bones and they start to break down, okay? As the vertebral body here loses bone, you get more and more load onto the disc, okay? It's very complicated, but there's a breakdown of this little layer where this vertebral body meets the disc, and it starts to create greater stress to the disc, and the disc starts to wear down. Various tissues in the back, so there's different ligaments and such, become less elasticy and more immobile. Our bone health in general peaks at age 35, and then it starts to slowly decline, unfortunately. This decline, like I said with everybody, can be controlled, okay? Your health, okay, your general health. If you exercise, what your diet is, and of course, genetics. These are all factors that will impact your bony changes in life. And right away, you can improve your health, you can exercise more, and you can improve your diet accordingly. Genetics, it's what you get, okay? But 3 out of 4, we can certainly make a change, and I think it's important for people to understand that. So to break it down a little bit more, if we look through here, a degenerative disc that's occurring, okay? It's what happens is you start to get more and more load on the column, on the whole spinal column. With that comes increased stress. And you'll start to notice in through here, these facet joints, you can see in this issue here, coming to here, look how it's changed. It's now starting to break down. The cartilage between those two joints is starting to wear down because it's taking more of that load. We recall in the previous slide, 30% load here, 70 here. Well, if this starts to, wear down these discs, you're going to start getting more and more load here, maybe 40%, 45%. And look what happens to these joints. They start to break down. That's where you're going to start getting inflammation and pain. You got to also remember all along this here is muscle, okay? And those tend to be very painful areas, those muscles. this term here, osteophyte and bone thickening. So the bone will thicken like a callus on our hand. If we press something over and over and over, we will develop a callus. It's our body's way to protect itself. So what's happening? The bone will start to thicken, and these little bony spurs form called the osteophytes. This all, in fact, just leads to a loss of mobility. Okay, so we slowly start to lose range of motion in our back. All right. The next one here, again, I'm going briefly over these things, folks. I don't want to bore you with the minutia of detail, but this is a simple way to understand what's happening. The second thing here is a disc bulge or herniation. Common, most people think about this, and they think they've blown a disc out or whatnot. So the disc is made up of fluid and connective tissue. So you can see this image here. You're going to have the fluid or this gel-like substance in the middle. That's our shock absorber. And we have these rings, like picture rings of a tree going around. And that's holding everything in place right in the middle. They're very, very strong. And this whole disc will be a shock absorber. These rings will resist torsion, traction, twisting, all those forces that can impact our back on a daily basis. However, those rings, if you do too much of something or you injure yourself, you can damage or strain a ring, like breaking the ring of like a tire. When the ring breaks inside the tire, it starts to buckle a little bit. And what'll happen in those situations, you start to have a little break, and that disc material can start to migrate. Okay, and you'll get something called like a disc protrusion. So now it starts to protrude out, very painful. These rings are full of lots of nerve endings, and it is quite exquisite, the pain, as I'm sure some people have experienced that. And more advanced, you can get a herniation, and that's where the element of this shock absorber has now protruded out of the ring and is now resting, often impacting a nerve, as you can see here. Okay, and that can lead to more acute pain down the leg, various cascades of effect there. Typically, these acute disc injuries are going to happen in that 35 to 55-year-old category. And the reason for that is because our body still contains quite a bit of liquid and nourishment in our tissues at that point. Those discs are still full. They're still full of water. They haven't dried up yet. Compared to over the age of 55, we start to get those bony changes in our back, increased compression, and tissues start to become inelastic, lose water content, and dry up. Okay, and so that's why these disc injuries tend to be a bit more in the earlier years. Okay, so that's a little bit of a brief synopsis of some anatomy and with some of the most common issues. Now, moving on, Alex is going to discuss some tips, some tricks on treating our back here a little bit.
Yeah, for sure. So we're gonna just talk about a few the best tips I could give. If I had 5 tips to give out, these would be the 5 tips I would, because there's obviously many different suggestions you could hear on the internet, but these are the 5 tips. And then the first one is talking about the core strength of our body. So really, to help improve your posture is something that we've always thrive to work on. We really need to learn the correct exercises for your body. So for example, when you have weakness in your lower abdominal muscles, you'll often find it very difficult for you to either sit or stand still, especially when it's for long periods of time. So therefore, one of the primary muscles of your core is something called your transverse abdominis muscle. So this is not something you often hear, because sometimes when people think of core, they think of like their 6-pack, which is funny enough, anatomically, the sixth, which is also known as your rectus abdominis, it's a muscle that's only found in the front of your abdominal region. So when people think about strengthening their core and all they're doing is sit-ups after sit-ups after sit-ups, to have a really good strong core, you must think of the core as being a sphere. So the strength of the core, it depends on or more like a cube. All 4 sides of the cube needs to be as strong to help really support the spine whenever you encounter a physical demand. So just by doing sit-ups, it won't be enough to really help strengthen your core. And therefore, what we really want to target more is your transverse abdominis. And we'll just call them TAs for short from here on out. So anatomically, So these are the deepest layer of abdominal muscles, which really function as an important stabilizer of your spine. Because if you look at it anatomically, they really wrap around the abdomen between the lower ribs and the top of your pelvis, and then they wrap around the sides and go towards the back and attach to the fascia of your lumbar spine. So essentially, if you look at it, it looks like a corset to the spine, and that's for that reason, they are the most important abdominal muscles in terms of back protection. And together, these TA muscles, together with the small multifidus muscles in the back, where the spine is found, when they work together, the multifidus and the TA muscles, as you can see here in the picture, they help stabilize the spine during any type of movement. And this is a concept known as core stabilization. So fortunately today, I'm going to help you teach how to turn on these transverse abdominis muscles. And following to the next slide. But before I go on to helping you teach how to turn them on, let's just take a moment now to really assess your own transverse abdominis, your own core strength. And if you guys want to just take the time now, if you could find a space right beside you to lie on the floor, and this is a one way to help assess your core strength, the strength of your transverse abdominis. So I'll just give you guys a little moment to just lie down flat on your back with both your knees bent. And when you do find a space on the floor with your knees bent, both of your knees bent up, keeping your feet on the floor, we're just gonna go back there, yeah. And you're gonna place both of your hands gently over your lower stomach, because that's where you could typically find your transverse abdominis muscle. Okay, so hopefully you guys found a place to lie down onto. So once you're in a position to assess your core strength, and you're gonna have your hands over your abdominal muscles, because your hands here, we're gonna check to see if you're able to hold your core properly. So to test your core, I'm going to now ask you to lift both your head and shoulders up off the floor, up towards the ceiling, just like a little abdominal crunch as seen in the second picture there. But you want to have your hands over your lower abdominal to see what's happening. Can you keep your tummy flat, or do you feel your tummy bulging out underneath your hands? If you feel a bulge or quivering of your body as you're holding that crunch position, it's a sign that your transverse abdominals needs a little bit of strengthening. However, if you're able to keep your tummy nice and flat, the good news, you probably don't really need to stay on for this webinar. But for most of us, including myself, the transverse abdominis, when weakened, you're gonna feel that big bulge just underneath your fingertips. So while you stay down on that position, lying down on the floor, now is a good time to also teach how to turn on this muscle in this position. So to help activate your transverse abdominis muscle, you continue to stay lying down on your back here and keep your hands over your lower abdominal, because this is where you're going to find your transverse abdominis muscle. Basically, the one way to really find this muscle, just to be sure where your fingertips are, if you find your pelvic bones on both the right and left side, just move with your fingertips an inch inwards. And if you do a little small cough, like do a little tiny cough, you should feel a little bulge of a muscle underneath your fingertips. That's your transverse abdominis. And to help learn how to activate this muscle, the verbal cue I like to tell people when you're ready to activate this muscle, you're gonna just think of slowly drawing your belly button down towards your spine, so down towards the floor. And if you do this right, you should feel like a slow contraction and a deep tension under your fingertips without any large movement of your pelvis. Essentially, under your fingertips, if you activate your transverse abdominis by again thinking about slowly drawing your belly button down towards your spine, you should feel like you're pressing down with your fingertips down on the surface of a hard trampoline rather than a hard rock surface, because it should still feel like a trampoline and not just like a solid surface. And if you're able to keep that muscle activated, you got to make sure also that you have a steady abdominal breathing and not just suck in your belly button. Of course, this is a very, very hard exercise to master, but with practice, you could feel that when you're doing that that crunch up again, you should feel a greater ability of keeping your stomach flat, because that is your transverse abdominis, your TA muscles controlling the core whenever you do a large movement. And usually when I work with a patient for the very first time, learning to activate your TA muscles, what I ask them to do just as practice to learn how to activate them is to hold that muscle contraction for 5 deep breaths, because remember, you always got to keep on breathing, not just sucking your belly button. And then after 5 breaths, you relax completely and you repeat it 5 times. Once, as you get better, onto the next slide, the activation of your TAs can be further challenged by keeping them on while either moving your limbs at the same time when you have your TAs contracted, either using weights and resistance bands or some of the pulleys at the gym. Again, always making sure your TAs are contracted, or even when lying down on different surfaces. Sometimes you see people lying down on a big exercise ball, or even in different positions such as standing and kneeling. And that's especially, those are the 2 positions that we often really need our core engaged. So really the challenge is always to maintain the TAs activated to keep stability control of your spine. And this is a transverse abdominis. I guarantee you, if you search up transverse abdominis and low back pain, you're gonna find a whole slew of research papers that were done to find the best ways of providing a good core foundation to help prevent low back pain. So on to the next slide, we're gonna talk about stretching. Because certainly stretching can be a big part of the tools to help with low back pain. So stretching the soft tissues in the back, hips, and legs can really help relieve back pain, but also help prevent it in the future. It really allows our muscles to stay flexible, strong, and healthy by preventing tension to build up over time. Because if you don't stretch enough, what tends to happen is that tension just continues to accumulate over time, and it may lead to an acute muscle strain someday. But people don't understand that how come some days are good, some days they're bad. To be honest, I find it pretty impressive that dentists are really good at telling their clients to brush their teeth to help build with the buildup of bacteria, which eventually leads into having a cavity. When you have a cavity, to me, that's like a muscle strain, an acute muscle strain. So I think that as a physiotherapist, I think it's my job to also tell people that stretching is like a way of brushing your teeth. And then instead of the bacteria that builds up, it's like tension in your muscles building up. And if you forget one day of stretching, well, which is fine, but if you forget a couple of days of stretching at a time, and what you do all day long is a lot of the physical activity, that's when tension just slowly creeps up, and eventually, when the muscle can't hold bottled up that tension anymore, you're gonna feel that muscle failure, and that's sort of that big acute strain that you feel in your lower back. So that's really the importance of daily stretching, routine daily stretching. Just like when you're brushing your teeth at the very end of the day, I always like to recommend my patients give it a good 30 seconds of stretching your lower back to always keep that tension level within acceptable levels. So I only include just a few stretches here, but if you look to the right of the screen, you're gonna see the Z-line position. This exercise is one I give when someone has a really, really acute episode. We've all experienced it once in a lifetime that when you have that acute strain, you feel that any type of movement would really exacerbate the injury. So therefore, this Z-line position is a very, very effective exercise to help decompress everything. The joints of your lumbar spine, the disc between your vertebrae, and all the muscular structures and neural structures in the lower back will help. This is the best way to decompress all of that. And how I like to instruct it to my patients is just to hold this position for about 5 to 10 minutes to start and really focus on gentle abdominal breathing at the same time when you're lying on this Z-line position, because this would all just help together, help relieve that acute pain and that elevated back tension that's built up. And then when you do feel better from the Z-line position, when you start to feel like the pain is becoming more manageable, then now it's always really good to, on a regular basis, to really focus on keeping and regaining their mobility back. So some of these examples for regaining the mobility are the knee to chest stretch, which is the first one here. This knee to chest stretch will help with regaining the flexion of your lower back. So for people who always tell me that first thing in the morning, I think I saw it in the questions. First thing in the morning, I feel like when I get out of bed, I could barely put on my sock. Like the one leg, I just can't get that knee up. The reason being because sometimes when you don't have the right spinal alignment when you're sleeping, the muscles are under a lot of tension, even when you're fully sleeping. But unconsciously, when you're not realizing that your muscles are trying to hold that good alignment when you're sleeping, so therefore the muscles are really, really tired from being activated all night long. And that's why you feel that tightness in the morning. So this need of, I always tell a person, before you get out of bed, roll onto your back, bring your knees up to your chest, hold it for a good 1 minute, and I promise you, you'll feel a big difference by putting on your sock the very next minute. The second exercise is the cat-camel stretch. So the first one is a cow stretch. That will help with the extension of your spine because we also do need to be able to extend through our spine. And the opposite to that is the cat stretch, which again will help with regaining the flexion part of your spine. Last but not least is to help with your lower back, never ever forget about your hips because the lower back, the way anatomically, the way it's designed to help bend forward and bend backwards. But you should not always depend on the lower back with any type of rotational movements. So what really should be rotating in our bodies is a joint right below our lower backs, which is your hip. So by making sure that you stretch your glutes, your piriformis, like the one, this is a figure 4 stretch, by making sure that you keep those muscles around your hips nice and flexible, you'll always be able to rotate through your hips rather than rotating through your lower back. So those are the stretches that, and then I'd be more than happy that if anyone wants more specific exercises, again, at the very end of the presentation, I'd be happy to address some of those stretches. The next tip I have, again, is always keeping up with general exercising. So some of these exercises are like low impact exercises like walking, biking, swimming. All of this can help protect the disc between the bones and your muscles because for all these low impact exercises, muscles still need to be conditioned to help you with any type of these aerobic exercises. So for example, like as we all know, the benefits of walking are tremendous, right? It's just a great way to combine a little workout and time to unwind at the end of a busy day. And walking, it doesn't need to be much. I know we've heard it from Fitbit, like the big 10,000 steps, but really, actually, 7,000 to 8,000 steps a day is actually enough to meet public health guidelines for minimal amount of recommended physical activity. And if you're able to put in 30 minutes of day of walking at the end of the day, that already equates about 3 to 4,000 steps, just depending on the stride length that you take as well. So the goal, if you want to stay conditioned, right, like walking will still be engaging your core as well, but the goal is to always keep your muscles of your core, your hips, your legs conditioned to any physical demand that you may encounter either during work or play. It's just by doing little activities on a daily basis as well. On to the next slide now, we're going to talk about ergonomic adjustments and the importance of always keeping that alignment in your lower back. So sitting in the correct posture while working at a desk will eliminate a great deal of strain on your back muscles. And like all of us, you may begin your day sitting in an upright posture with good intentions, but inevitably, as your muscles fatigue, you can start to feel like you're going to start to begin to slouch, like in the first picture over here. And after a while, you're going to feel like your hips are starting to slide forward, and eventually you lose the full support of the chair's backrest. Now, an adequate lumbar support either from a chair or using a lumbar roll, like the one demonstrated in the second picture, or even if you don't have a lumbar roll, sometimes what people tend to use is grabbing a bath towel, roll it up nice and tightly. Doesn't have to be too big because all it needs is just as wide enough to fit into the small hole of your back and right behind, above your belt line, so that once you put this lumbar roll and once it fits into the small of your back, it will help support the natural curve. Because if you don't have that natural curve of the lower back, if you look at the spine anatomy, it's always an S-shaped curve. If at the bottom, if this S-shaped curve does not curve the way it should be and instead it's going the other way, then what tends to happen is that your muscles will do the support instead. But like I said, when we sit, we need to relax those muscles, right? So don't let those muscles keep your spine in a good position when you're standing and sitting at the same time. When sitting, really help minimize that gap behind your lower back and let the backrest of the chair help support that spine curvature. Because really, without leaning into your lumbar curve of your chair, the alignment of your lumbar spine is going to either arch too much, round too much, really causing these muscles to strain and really increase the pressure on your joints and disc at the same time. So this really can explain why people feel really stiff getting up from their chairs, all due to improper sitting and disuse of the chair's lumbar support. Finally, my last tip for today is a few tips. Since most of us are working from home, I'd be happy to share tips for sitting and standing. So for tips for sitting, always bring, again, like I said, when you're about to sit, always bring your hips as far back as you can on the seat. Really scoot to the very far back end of the seat so that your lower back is fully resting on the lumbar support of the chair's backrest. Always minimize that gap because once you have that little bit of gap behind your lower back, guess what? Your spine is now going to be held on by the muscles And then when the muscles are working all day long with the lifting that you do on your 2 feet, and now you're continuing to make those muscles work to support your spine where you're sitting, there's never an opportunity for those muscles to finally relax. So another tip as well, when you're sitting, always sit in the front of your sitting bones. This will help prevent your pelvis and your lower back from slouching down. And as a result, you lose the natural curve of the spine. And lastly, your feet should always be flat on the floor and your knees level with the hips. Now, tips for standing. Stand close to your workstation. Place your foot on a ledge of an open cupboard or a small step stool, because unfortunately it's not pictured here, but if you have one foot up elevated, it's like, if you guys ever wonder going to a bar, a nearby bar, and you'll notice like a ledge by the bar, right? That little ledge is for those who stand all by the bar. Is once you put your foot on the ledge, it really helps maintain that natural curvature. So therefore, look at, like, you know, you don't want to have the bar be more ergonomically sound in your workstation, right? So if you do happen to stand, feel free to grab like a step stool right beside you, so that from time to time you can place one foot on a step stool, and you'll see a great amount of relief of pressure in your lower back as well. And lastly, have your work at a comfortable height without the need to bend forward from your lower back. In the end, no matter how comfortable you get, your back won't like sitting or standing still for long stretches. Always remind yourself to get up and move around for a couple minutes every half an hour, and this will give your body a break. So those are my 5 tips I have for today.
Excellent. Okay, Alex, break down this last bit and then we'll get into some, everyone's been putting in a lot of questions here, so we're going to get to those questions here in a second. So Alex, tell us, break this down, the number one mistake in our healing process, please.
For sure. So, you know, like it's all about consistency, right? Just be very patient and persistent with your core exercise when rehabilitating your lower back. And yes, core exercise, and I would say just as equally important, doing the stretches. If you spend 2 minutes brushing your teeth, which I hope it is the case, brushing your teeth, at least spend 1 to 2 minutes doing your stretches. And if you're able to do that twice a day, that's what's going to help these injuries from recurring, right? To always do a daily little routine. And by doing this, you're going to do a huge favor for your lower back. Because honestly, the moment you have that back injury, what research have shown that following a back injury, those transverse abdominis muscles, they are weakened and did not regain their strength on their own. So as a result, it's really up to you to learn how to engage your core again, right? Because without the TAs becoming strong again, the result is poor stabilization of your spine and less protection to your spine as a larger, more superficial muscles take over. Because when these muscles take over around your spine, around your lower back, those are the ones that always need massaging out, acupuncturing, and stretching, right? But really, it all comes down to that transverse abdominis muscle to really keep that in check all the time, right? And lastly, like a weak core will just increase the risk of back injury, and is the main reason why so many of us suffer from a chronic low back pain. So it's all about routine practice of core exercises and stretches, which is now considered to be one of the most effective management tools for low back pain.
Look at that, even Santa has problems, Alex.
There you go. It took me a while to find that picture, but I was really happy to find it.
Very timely.
Yeah.
All right, great. Okay, listen, folks. So there's a lot of great information here. And I'm sure a lot of people will say, oh, can you send me the exercises and stuff? So one of the things to get more out of what we're talking about tonight, feel free to type into the chat if you want this survival guide, let's call it. This is going to be a list of some exercises and tips to treat your back pain at home, some of the stuff Alex has been talking about. Or if you want to discuss your case a little bit more, we're offering a little 15-minute complimentary phone or video consult. So you can type in treatment if you want to speak to us about your problem a little bit more. Again, it's complimentary, no charge, or both. So if you want the guide and you want to speak to us, write down both. So in the chat, type in survival guide, treatment, or both. And if you don't want anything and you have super strong core, then good for you. But if you need some help, feel free to add that into there, and we'll get in touch with you with that. And I know Aaron's been taking a look at all the questions that have come in, and we're going to get to those now. And hang tight. We're going to do a few questions first, then we'll do the prizes and wrap up there. Just to let you know, the webinars that we do, we've had about 7 or 8 of them now at the clinic this year since COVID started, and we're going to keep going on. They are available on our websites. There is a little webinar button you can click on. You can go through and watch all the different webinars. So this one will be up shortly. We'll get to getting it back up so you can share it with friends and family. Just a bit about us. If you have, again, more specific questions and you typed into the chat a treatment, you'll hear from Alex or I. But we're here to help. You can call the office. You have questions, talk to a physio. It's free. We can give you some advice on what's going on and let you know if you need to see us or not. We are doing some virtual treatments. Feel free, if you go onto virtualphysios.ca, if you're not really comfortable leaving the house with COVID right now, we understand. We have all our safety procedures in place, but we understand there are still some trepidation, and that's normal. Feel free, you can check out virtualphysios.ca. More specifically, you can email myself or Alex directly. There's the emails there, and we'd be glad to respond back to you. Alex and I are both very passionate about this stuff, and we treat a lot of low backs at the clinic. Alex had some great information there. So, and again, where you can find us for more tips, if people are on Instagram, check us out, Aurora Sports Med Pros, or Facebook. You can like us and follow us there, Aurora Sports Med Prof. We tend to update with lots of neat videos and tips and everything on a variety of topics. Okay, so maybe what we'll do, Aaron, if you can help us out here, we're going to answer some questions here, folks. We got about 10 minutes, so we're going to hopefully answer some questions and then do a little bit of a prize giveaway. Our prize giveaway, we have a lumbar roll that Alex was talking about, also a TheraBall, and we're going to give away a little 30-minute gift certificate for a massage as well. I can't guarantee you're going to get a massage now in the next couple of weeks. It's pretty busy. But for the new year, after everything dies down, I'm sure if you want, you can come on in and redeem your gift certificate. So Aaron, we'll wait to do the prize giveaway here, but why don't you walk us through the questions first of all?
Yeah, for sure. So there were a ton of great questions. So we'll try to make our way through all of them. The first question is with regards to how to, continue walking and exercising when you may have other orthopedic issues. For example, this participant is wondering about degenerative knees, how to kind of get away with still exercising.
Okay, I mean, you can try to find an alternate source. Maybe if you have a stationary bike, that's an option. Perhaps let's say your knee pain, you know that you can't walk more than 20 minutes. Maybe you need to break the walk down a little bit, 5 minutes, 10 minutes at a time. Take a break or understand what your limitation is of maybe some other musculoskeletal issues like your knees. Maybe it is 20 minutes. So you do 7 minutes out and 7 minutes back, and you're always staying under that threshold with your knees. Or finding an alternate source.
The other thing, sorry, Jill just corrected me, was also related to proper lifting with knee issues.
Alex, you want to hit that one? That question?
Yeah, with due to the knee pain, right? So it's a very valid point, right? Like, it's just a matter of looking for other options around the family members. That's one of my easiest tip for you, right? But like when it comes to the scoring diet, it will take practice, because I did mention this before that with knees, if you look at what's between the knees and your lower back, it's your hips, right? So get the mobility back in your hips, and you're gonna find, like, don't always be so focused on the knee when your pain is there, and don't be so focused on your lower back when the pain is there. Always think up outside the box, and it really help address the hips. And this is where your physiotherapist can help identify if there is a lack of mobility in your hips as well. So I would definitely
I agree.
Do your very, very best to get that hip as mobile as you can. And believe it or not, it's gonna really help your knee and your lower back tremendously, because the body's really smart. When the body is restricted somewhere, let's say in this case your hip, the body's really smart to get you to squat down. What it's gonna do instead, it's gonna use your lower back and your knee instead. So this is what we would call compensatory movements, right? So by addressing the primary source of the issue, which would be a stiff hip, you'd be surprised how well you could be able to hit the lift again.
Great.
Awesome. Thanks, Alex. Next question is about disc herniations. How are disc herniations corrected?
Yeah, typically disc herniations have been treated in most cases with an extension protocol. It was created by Robin McKenzie out of Australia years ago. And it was basically, if you recall on my previous slides showing the spine flexing or extending, the scenario in that case is going through a series of extension movements to create more load into the posterior part or the back part of the disc to perhaps guide or help push that gel material back forward so it's not protruding back anymore. So a lot of the treatments in the past have been for an extension type of pattern of movement. Certainly with someone who thinks they may have a disc problem, you should speak to someone about that because we're just assuming, okay, folks, I can't see you, I can't see how you're moving, where your pain is. It may be a disc, it may not, but certainly that would be the general type of sense of treatment for it.
Thank you, Mike. Okay, next question is regarding spinal stenosis. Can it be helped without surgical intervention? Are there any specific exercises not to do?
Yeah, so I'll take that one, Alex. Yeah, so spinal stenosis is, again, it's a normal age-related change to a more severe extent. And on that slide, I showed the spine compressing, all the osteophytes forming, and the thickening of bone. And what happens there is all those changes actually start to encroach into that central canal area where our spinal cord actually is. So as it's creeping in there, that opening for the actual canal starts to shrink because it's filling in with all this bony material and such. The big thing to avoid with a stenosis problem is a lot of extension movement where you're leaning backwards. That tends to make stenosis feel worse. A lot of people you'll find who have been diagnosed with stenosis, they often notice they're leaning forward on their the shopping buggy at the store, or they just have to sit down for 5 minutes and it feels a lot better because you're opening up the vertebral column, you're giving that space again back to the nervous system, and usually that's a reduction in pain. So certainly I would avoid any sort of extension movements that would be creating a greater load on the spine. Following Alex's tips, good core strength and the mobility around the hips, flexion, any of those flexion type mobility exercises would be good for that person. Sorry, I'm being very general on these senses, but I hope everyone gets a sense of what we're talking about. These are all advised for certain conditions. Again, everyone's condition may be different. So, certainly email us or reach out to us.
Yeah, for sure. It's much better to give like individualized information, but it's hard in this setting.
Yeah, no problem. It's good to hear the questions because a lot of people might feel like they have the same issues.
For sure. Can the Z lying position or decompression position be done with legs up on the wall, or do you recommend on a chair?
What do you think, Alex?
It's a very good question. The Z-lying position is a stretch, and I always like to educate my patients. The best stretches out there are the ones that require as minimal muscle activity as you can, because stretches are meant to reduce muscle tension. And the moment you need to use a muscle, naturally there's tension, there's going to be tension involved. But if you really want to get the most of a stretch, which is actually, it should be a relaxing thing to do, having your foot up on a wall, you will need to use a little bit of your muscles to keep your legs up on the wall, or else naturally the legs will just fall downwards. And if you think about some of the muscles that's required to keep your feet up on the wall, it'll be a bit of your hip flexors. And unfortunately, you might have heard this before, to stretch your hip flexors to have a good low back. So I wouldn't recommend putting your feet up on the wall. But instead, if you left it on, it doesn't have to be a chair. It could be, it's like if your seat of a couch is deep enough, you can do it on the couch. Or sometimes for those who have the luxury of having an exercise ball, that's another great way to performing the Z-lying position. Because once you rest your legs on the furniture or on the ball, you'll realize that you could practically sleep in that position because there's no muscle activity involved, right? And that's particularly for the Z-line position, that's the one that's given when someone has a severe acute pain. Your goal is to really relax as much as you can in terms of those muscles that we're talking about.
Perfect. This question's come up a couple times, and I think it's important to address ice versus heat, when to use one or the other.
Okay, I mean, this is a contentious topic in the health world. Generally, my advice to people is if something is hot, red, swollen, I like to ice it. Especially, let's say, a low back, when maybe you've acutely injured your back. It's just happened, you've pulled something. There's going to be an inflammatory process that's going on there, and that's when the ice would be recommended. For a short period. Okay, that may be a day, maybe two of using some ice. And you would apply it for 10 to 15 minutes, a damp cloth. Protect your skin, don't sleep with it, and you put it on for that period of time, and then let the tissue heat back up for a couple hours before you reapply. In most instances, just in the non-acute setting of back pain, I recommend heat. As I showed you in those slides before with the anatomy, the normal age-related changes, we get the immobility and the decreased elasticity, and things start to tighten up. So obviously, if something is warm, it's easier to move. It'll reduce muscle tension, and it'll loosen up some of the structures in your back. So I would recommend heat in those types of scenarios. The only time, again, using ice is in that acute injury phase. Otherwise, heat all the way for me.
Okay, I'm gonna just.
Sorry, Aaron, can I just add to that? Don't sleep with the heat pack on either. I've had people do that and they've burned themselves. And you need to be very careful, because the body does 10 to 15 minutes of heat is sufficient. You need to remove that heat pack, because the tissue does, if you left that heat on, like one of those electric heating, blankets and stuff, the body loses its ability to dissipate the heat from that tissue, and the tissue basically temperature rises and you can internally burn it. So please, folks, no burns, 10 to 15 minutes.
Thanks for clarifying. Okay, so the next question, I'm just gonna kind of group a couple things that are similar. Ergonomic chair brand, if you guys have one that you recommend, or different types of pillows or shoes. So those are three kind of things people are wondering about.
Ergonomic chair.
Yeah.
It's again.
Chime in if you want, Mike.
Yeah, go ahead, Ox, if you've got something to.
Yeah, so honestly, any brand out there can actually make a great chair. It really comes down to the lumbar support of a chair. I do, well, now it's gonna be a little hard, but I do always recommend to try the chair first at the store. Some of the ones that I would recommend are the mesh ones. The reason why the ones with the mesh fabric of a backrest are the ones that I tend to lean towards to, is because they're more durable, right? It's all about durability. Because like sometimes you'll buy that leatherette chair, and over time it will lose its support and integrity, and therefore that low part of the backrest starts to disintegrate and it gets flat again. Whereas a mesh chair, due to the make of it, it will support its shape, that lumbar support at all times. If you guys really must know, it really comes down to if cost is not an issue, my go-to is usually Steeplechase is one, so Steeplechase. And the second brand is that if cost is not an issue at all, it's Herman Miller is another really good one. The middle tier brands that are more cost friendly are the one was called excuse me, well, you know what, even at Staples they have a really good chair called the Hyken chair, spelled Hyken, and that's a middle tier. And it really, like I said, it really just comes down to the lumbar support, and the lumbar support, unfortunately, is not designed for everyone's back, so it's all about trying it out first at the store, and then before purchasing it, right? Because I know it's just like a pillow, it's just like a shoe. It's really, really hard to find the perfect one, but just always look out for that lumbar support at the bottom half of the chair.
Perfect. And then other we were wondering about was shoes and pillow.
Oh, yeah, pillows. I get a lot of questions about pillows, and you know what, it's so hard to recommend a pillow for someone because we're all different shapes, sizes, the way we sleep. I don't have a particular pillow I recommend. For shoes, you know, that's a good supportive shoe that's cushioned, is my best suggestion for you. Again, it all depends on the person and their body configuration. It's really hard to say, you know, what exactly, but you want to have a fairly good walking shoe to go walking. You don't want to be putting on one of these little flimsy slide type shoes, these foam shoes to be doing any sort of exercise in. Okay.
Yeah, and sorry guys, it's not steeplechase. That's actually the name of a
Oh,
investment company. My bad. It's been a long day. It's Steel Case.
steel
STE.
case.
Yeah, Steel Case chairs. Sorry, I'm reading that. I'm like,
Maybe Steeplechase sells steel case chairs, Alex.
sorry about that, guys. Steel Case, and it'll be in one word too as
All
well.
right, buy Steeplechase, people. Here we go. All right. Well, let's do maybe one or two more questions, Aaron. And listen, folks, if there's questions, we'll go through the whole chat and Q&A. If we didn't get to them, we will circle back and reach out to you and make sure that all your questions have been answered. So don't feel like we're going to avoid your question. We will reach out and make sure on that. There is one comment here, the core chair. Yeah, excellent chair. I use the core chair at work. Joe, you wrote that. Thank you. Yes, the core chair is great. It really promotes a lot of active sitting. Again, a little bit more expensive, but a very good chair. Have a look online. It's a little different than what you've seen before, but it promotes a lot of active sitting. So great chair. All right, Aaron, another question or two, and then let's do the prizes so people can get on their way. We're just a few minutes past the time here, and I don't want to hold up people too long.
Yep. I think one good one is it bad when your back cracks?
So when your back cracks, the likelihood is over time you've been probably self-adjusting your back. So you've made these twisting movements, and there's a release of pressure. That's mostly what the crack is. It's also likely an increased mobility, or we call like maybe a hypermobility in the back. So there's more likelihood that the pressure needs to be released to give you that relief. You'll also get that temporary muscle relaxation when you adjust or crack your back. But over time, over and over and over, I mean, it can lead to some unstable joint issues. To combat that, strengthen your core. That's the best advice I can give you for that. All right.
Perfect. And then one last question here related to the exercises that I believe Alex went over. Number one being, can they be done from bed for people that are unable to get onto the floor? And number two being, how many times a day do you suggest doing them? So specifically tips 1 and 2, which I believe was the Z lying and stretching, Alex. I can't remember.
Yeah, so those are really good questions. Yeah, typically doing it from the mattress is just fine. The ones that I've demonstrated there, so those are like the knees up to your chest, the glute stretch, the cat cow stretch, the middle one, which is done on all fours. I would recommend doing this on the floor just so you have a better surface to work out of. How many times a day? I always tell people, on average, if you brush your teeth twice a day, try to do your stretches twice a day. That's the easiest way to remember. But also strategically, there's some exercises that are more beneficial in the morning or the afternoon. My personal favorite one is the knees up to your chest in the morning because you're already lying on your back in the morning and lying on your mattress. So feel free to just get those knees up to your chest, hold it for a good 30 seconds. That's how I would tell people to do it. Hold it for 30 seconds. The moment you've held that stretch for 30 seconds, you've allowed the muscles to stretch out and finally reduce the tension that won't be as elevated without doing it the moment you get up from bed in the morning. And then last but not least, it's also very important, really important to do these exercises at the end of the day because tension in our muscles only start to build up as the day goes on, right? You probably notice that if you have a physical demanding job, you probably notice that your weekends are actually better days than your weekdays. The only reason being is because you haven't built up as much tension, right? So I always tell a person that ideally in the evening, try to do those stretches at the very end of the day so that you can help reduce the muscle tension. Because without doing so, guess what? The muscle is going to accumulate that muscle tension and carry it over to the next day, and carry it over to the next day, and carry it over to the next day. And then finally, it's Saturday. I'm going to do some snow shoveling, and bam, too much tension in your muscles. Your muscle will strain, and unfortunately, it's something to do that has to be addressed right away.
Excellent. Okay, I'm going to just hop off this share, and Aaron, let's do the prize giveaway now, okay?
Yep, sure.
Okay, so I'm just going to, folks, hang tight here, and we're going to just flip into the mode here. Aaron's going to pull up. We have a wheel here with everyone's name on it, and we're going to do a little prize giveaway. Aaron, I'm just pulling up our list here of people. So why don't you spin the wheel? So this is going to be for the lumbar roll. Alex, do you have one there by any chance? Can you go grab it out of the?
Yeah, of course.
Yeah.
Okay, are we ready for the spin?
Yeah, go for it. Okay, folks, so this is going to be for the lumbar roll. Alex is going to show you what that looks like, and let's see who we get here, and we'll see if they're in this. Ola A. Is Ola here? Oh, yes, I see her there. Ola, can you just type in the chat, I'm here? Make sure you're here. Ola, are you there? Alex, do you see her name? Yep, there she is. Good, Ola.
Congrats,
Perfect.
Ola.
Okay, Ola. All right. Next prize is going to be a Theraball. So you want to give that another whirl there, Aaron? And then I'm going to just search our attendee list here and see. Sometimes we need to do a few of these. Who do we got here? Jasmine. Where is Jasmine? Is Jasmine here? I don't see her here. So let's spin again. Hang tight, folks. Who do we got here now? Lisa B. Lisa, are you here? Can you type into the chat if you're here? All right, Lisa, we got you. Perfect. So that's two. Last but not least, a 30-minute massage gift certificate. Go ahead. Listen, everyone, thank you for attending tonight. By the way, we really appreciate your attendance, and we really do appreciate this time. Sandra, Sandra here. I don't see Sandra there, so I think we might need to.
I think Sandra is here.
Oh, is she?
I think I was chatting with her. Let's give her a second.
Oh, there she is. Sorry, Sandra.
Oh my gosh, you're trying to pass up the massage for poor Sandra here.
No worries. Don't worry. We'll get that massage to Sandra. Okay, perfect. So if you can close share yours there, Aaron, and I'm going to just hop back on here. Okay, everybody. Again, we are done for the evening. If we didn't get to your question, sorry. It's just this is such a big topic. There's a lot of interest, so I really appreciate, and on behalf of Alex and Aaron, we do appreciate your time tonight. And we'll reach out and make sure we answer all your questions. Again, if you want more, here's the options: survival guide, treatment, or both, and we'll reach out. Otherwise, happy holidays to everyone. Please be safe, be well, and Merry Christmas to those who celebrate. Happy Hanukkah to those, and all the rest, and enjoy. So thank you, everybody, once again for attending, and we'll see you in 2021. We'll have an exciting lineup of new webinars all year long, and we're going to keep rolling with this. So thanks again, everybody.
Thank
Appreciate you.
Happy holidays.
Happy holidays, everybody, and a happy new year. Let's hope for a good 2021. We need it. Thanks, everybody. All right. Okay. Toodaloo.